Diabetes is a chronic condition in which the body cannot produce enough insulin, or when our cells cannot utilize the sugar in our blood, leading to either too high or too low blood sugar. High blood sugar shows up in frequent urination and frequent thirst, which are the most common signs of diabetes. But there are some less common and very unusual symptoms of diabetes, which are like red flags that you shouldn't ignore. Let's see what are those and how to identify them. Let's begin. Number 1. Dark patches around the neck. Otherwise known as acanthosis nigricans, dark patches may not just appear on the neck, but also on other parts of the skin, especially the ones where skin creases are prominent, like armpits, elbows, knees, fingers, toes, and even the groin area. These dark patches indicate that you may have obesity, type 2 diabetes, or insulin resistance. Having insulin resistance means that your body's cells are not responding to the insulin as they did before. As a result, blood sugar levels keep increasing, and the pancreas keeps producing more insulin to compensate for the resistance. These high insulin levels promote the production of IGF-1, or insulin-like growth factor 1, which is a growth hormone. It causes the skin cells to multiply, leading to those dark patches. Also, high insulin levels also tend to stimulate the production of melanocytes, the cells that make melanin, the pigment that makes our skin appear darker in color. But do remember that acanthosis nigricans isn't always due to diabetes. It can also happen due to obesity, certain medications, and sometimes even hormonal disorders, particularly polycystic ovary syndrome or PCOS in women. So if you notice dark patches around your neck or other creasy parts of the skin, do not ignore them and get yourself checked as soon as possible. Before we move on, please take a moment to subscribe to the channel and hit the bell icon. If you find our videos helpful, please support us by becoming a patron. Number 2. Unexplained weight loss. Although diabetes is more common in people who are overweight or obese, however, type 1 diabetes and poorly controlled type 2 diabetes can cause weight loss too. This can mainly happen due to insulin resistance, because when your cells aren't responding to insulin, they won't be able to utilize blood sugar to produce energy. As a result, they begin to utilize fat and muscle proteins for energy, leading to weight loss. Number 3. Dizziness. Low blood sugar can cause dizziness in diabetics. This can happen due to low blood sugar, usually below 70 milligrams per deciliter. This low blood sugar is also referred to as hypoglycemia and can result from overusing insulin or other diabetic medications, skipping meals, or over-exercising without eating enough. This can reduce available glucose for the brain to work properly, leading to dizziness. Hypoglycemia-related dizziness is a medical issue that needs immediate medical attention, because if not treated properly, it can lead to unconsciousness and even coma. Fast-acting glucose from fruit juices can help relieve these symptoms, but remember to have a balanced meal or snack thereafter to help maintain your blood sugar. Number 4. Vision problems. Uncontrolled or poorly managed diabetes can cause many eye problems. Cloudy or bloodshot vision might result from blood sugar changes, particularly when high blood sugar causes the lens of your eye to expand, making it temporarily harder for you to focus. People with diabetes may need new glasses or contact lenses more frequently than they used to. This is because frequent changes in blood sugar can affect the shape of the lens of the eye temporarily, but frequently. Some people with diabetes can also develop eye cataracts or glaucoma. Cataracts can happen when high blood sugar causes the extra glucose to accumulate around the lens, while glaucoma can happen when high blood sugar damages the blood vessels that supply blood and nutrition to the eyes. Diabetic retinopathy is perhaps the most critical thing for a diabetic to worry about. In this condition, high blood sugar damages the blood vessels in the retina, which is the area of the eye that governs vision. And if it isn't treated well in time, it can get much worse and cause permanent vision loss or blindness. Number 5. Sexual dysfunction. Another indication of diabetes is erectile dysfunction, which usually affects men with type 2 diabetes and makes it hard for them to get and retain an erection. Women with diabetes may experience bad sexual health due to neuropathy, in which the nerves that control sexual activity get damaged. They may also experience hormonal changes, fertility issues, and low sexual desire. Number 6. Developing infections frequently. Uncontrolled blood sugar in diabetes can affect your immune system and your body's ability to fight off sickness, which can lead to repeated infections. Too much sugar in the blood can make white blood cells less effective, which can lead to recurring infections, especially vaginal infections in women. Other common types of infections in diabetic people are urinary tract infections, skin infections, and lung infections. Also, people with diabetes may need more time to recover from diseases than people who don't have diabetes, which is also a sign of weaker immunity. Number 7. Dry skin and itching. Dry skin and feelings of burning or itching in the skin can happen when the body can't generate enough oil or sebum to be more specific. Anywhere on the body can get itchy in diabetes, but the lower legs, feet, and ankles are more likely to do so. Itching in diabetes is a sign of neuropathy, in which the tiny nerves that control these feelings get damaged. So, a person with neuropathy may experience feelings of itching, tingling, or burning in hands and feet. Number 8. Fruity smelling breath. Fruity breath is a less common indication of diabetes, and it indicates diabetic ketoacidosis, which can be dangerous and possibly life-threatening. It is more common in type 1 diabetes and pretty rare in people with type 2 diabetes. This condition can happen due to high insulin resistance or insufficient insulin. In that case, when your cells aren't able to produce energy from sugar, they start breaking down fat for energy. This process produces molecules called ketones, which are responsible for that fruity or sweet odor in your breath, also known as acetone breath. Number 9. Pain in legs and feet. This kind of pain is closely related to diabetic neuropathy or peripheral neuropathy. In people with diabetes, high blood sugar levels can damage the nerves that control touch sensations on our skin, leading to symptoms like sharp shooting pains, feelings of burning or tingling, or a sensation of getting pricked by pins and needles. Another possible reason for this pain is atherosclerosis, which can happen because of diabetes too. Consistently high blood sugar in diabetes can also cause hardening and narrowing of the arteries, which can lead to poor circulation in the legs and feet. Reduced blood flow can cause pain, cramping, and aching in the lower extremities, especially during physical activity. Number 10. Nausea and vomiting. These symptoms can happen in many cases, whether you have high blood sugar, too low blood sugar, or high insulin resistance. High blood sugar can cause excessive urination, causing the loss of electrolytes from your body. And if blood sugar levels get too low, or if insulin levels get too high, it can cause symptoms of hypoglycemia, including nausea, sweating, and vomiting. Diabetic ketoacidosis too can cause nausea and vomiting. This is because the breakdown of fats produces ketones, which are acidic in nature, and increase the concentration of toxic acids in the body, leading to fruity breath, nausea, and vomiting. So watch out for these diabetes red flags and get immediate medical attention as soon as you notice them. Thank you for watching and subscribing to the channel. See you in the next video.